You're listening to a podcast from Cancer.net. This cancer information website is produced by the American Society of Clinical Oncology, known as ASCO, the world's leading professional organization for doctors that care for people with cancer. In today's podcast, we'll discuss meeting and working with a child life specialist and some of the techniques that teach children to help them cope with their diagnosis and treatment. This podcast will be led by Carolyn Fung and Molly Spragins. Ms. Fung is a certified child life specialist in the Department of Family Services at Children's National Health Systems in Washington, D.C., and Ms. Spragins is a certified child life specialist in the Pediatric Blood and Marrow Transplant Program at Duke Children's Hospital and Health Center in Durham, North Carolina. ASCO would like to thank Ms. Fung and Ms. Spragins for discussing this topic.
Hi, I'm Molly Spragins, and I'm a child life specialist for the Pediatric Bone Marrow Transplant Unit at Duke Children's Hospital.
My name is Carolyn Fung, and I am a child life specialist at Children's National Medical Center in Washington, D.C.
So, Carolyn, could you talk about the process of working with a child life specialist in your department?
Yes, so I am a child life specialist in the Center for Cancer and Blood Disorders Clinic, Children's National. So my role is primarily in the clinic serving patients, hematology, oncology, as well as those coming for a bone marrow transplant. And so it's a very procedure-based space in which we have patients coming for lab draws, for IV starts, if they're having a port accessed, as well as a lumbar puncture or a bone marrow aspirate or biopsy. So my role is very focused on how do I help that child or teenager cope through the traumatic procedure that can cause anxiety. And it's not something that we get right on the first try. It's a lot of trial and error, but figuring out what works best for this patient while partnering with the parents to incorporate them in our care and making sure that we have their child at the center of the care we're providing. So family-centered care is a term that's often said amongst different facilities, and we definitely do aim to provide family-centered care here at Children's National.
Awesome. And I think that's a great definition of what child life looks like outpatient in a hematology oncology unit. And for us, I'm on the inpatient side. It's less procedure-based and more long-term coping. So we work a lot with the families before they come into the hospital, preparing them for what it's going to be like to stay in the hospital for extended periods of time, and then teaching them different coping techniques to process being in the hospital and being away from their life for such a long amount of time. And that looks different each day, teaching different kids of different ages how to cope and learn how to gain skills needed to get through a long hospitalization.
And so, Molly, being at Duke Children's Hospital, you have kids coming from all over the world to come for a bone marrow transplant. So what does it look like at your facility for when you first meet a patient? What does that look like?
So our program is pretty well organized, and we have nurse coordinators who set up. They're the first face for the families, and they meet the families and do a little bit of education and then set up their entire evaluation for bone marrow transplant. And part of that evaluation process is meeting with a child life specialist. And so I'll meet with them and do an assessment on where they are and their understanding of why they're here, why they're getting a bone marrow transplant, and any existing trauma that they might have experienced at other hospitals, as well as maybe different coping things that we need to work on. And this just gives me a starting point for when they're admitted. So I usually meet them anywhere from 2 weeks to 2 months before they are admitted to the hospital for their bone marrow transplant.
Wow, so that
Carolyn,
sounds like a really in-depth process. That's awesome.
Yeah, it is. It's a pretty detailed process, but it's good for child life to be a part of it for sure.
Yeah.
Carolyn, you mentioned doing a lot of procedures outpatient with patients who are getting port access or different kind of things done. What are some techniques you use to teach children to help them cope with their treatment and their diagnosis?
So one of the main coping techniques that we use at Children's National is considered bear hugs. It's also known as positions of comfort. And what it is it's the idea that we can put a child in a position that is safe for the medical team, but is comforting for both the child and the parent. And so we advocate to use positions of comfort at all times, no matter the age. So most often for school-age children, that looks like sitting on a caregiver's lap If they're having a port access, they might have their hands down and they might be engaging on an iPad. If it's for an IV start, a parent might be helping to hold the arm out. And that's really nice because it becomes a comfort measure. And what's nice is that when you have a child sitting on your lap, the caregiver is able to talk to the child in their ear at a quiet voice, and we can really minimize the additional voices that are coming from around the room. And it's quite soothing. So we try to use that, whether it's for IV start, lab draws, port accesses, even for induction, whether it's having a caregiver lay alongside the patient and kind of soothe them while they're getting a mask induction, or just trying to go through the process of vital signs. That's another area that can be anxiety-provoking for patients. And so we can do positions of comfort for having blood pressures taken and having temperatures taken. So pretty much from beginning to end of an appointment, we can use positions of comfort at least twice in a visit. Another thing that we use quite often, which I think that Children's Oncology Group has helped to share with patients and families, is using press and seal saran wrap. It has to be the press and seal. And they say not to use the store-bought, but the actual brand by Press and Seal, that you can put that on top of a patient's port access with EMLA or LMX cream prior to. So a lot of times I'll tell families when they arrive at Children's in the parking lot, go ahead and put the magic cream on their child's port and then cut out a square that's 3 inches by 3 inches and put that over top of the EMLA cream. And then by the time they get up to our clinic, they get checked in and we're ready to access their port, that cream has been on for about 45 minutes. And so it's just really easy to take that off. The alternative to using it is to use a more sticky bandage, which can require using detach-all to remove it. It can cause children to get really upset, and it's not the best way to start an access. So we really encourage patients that are using a magic cream, whether EMLA or LMX, to use press and seal saran wrap to help with that aspect.
That sounds great.
Yeah. Now, Molly, when you meet with families prior to transplant, do you meet with the patient individually? Do you meet with their parents as well? What's kind of the breakdown for your meetings?
I meet with both patients and families. If the child is 13 and older, I try to meet with them one-on-one just to start the rapport building process, and oftentimes parents can answer a lot of questions for their children, and I like to hear from teenagers themselves who can sort of get kind of quiet and reserved during the process. And so if they're 13 or older, I'll meet with them one-on-one, not for anything secret or something that the parents wouldn't know. I would tell the parents exactly what we're going to talk about. It just gives me a chance to talk to the patient about what's going to happen, get a feel for their understanding, maybe some things that they're struggling with about the process or what is about to happen, and start thinking proactively of ways to help them cope. We find that teenagers need a little more support during the bone marrow transplant process just to remain engaged with their community and with their friends, and so we want to be proactive so that when they're done with their transplant and have been approved to go back to school, that they can re-enter school smoothly without too many issues. And so I try to meet with teenagers individually, and then if they're under the age of 13, I'll meet with the patient and the family and just kind of go through all my questions and get a good idea of where that child is emotionally and psychosocially about the whole process, and also educate them about what's about to happen in their developmental language, so something that they can understand, and answer any questions they have. Often parents ask me questions that may not have anything to do with child life, but about the bone marrow process, and being a safe person that they can ask, I'm able to relay those answers to them in a way that's easier to understand. Sometimes the doctors get really over the top with their explanations and their medical jargon, and so sometimes it's helpful, even for the parents, to have child life kind of sit down with them about what the process looks like once their child's admitted. So I do meet with both patients and families depending on the age. Carolyn, what advice would you give for parents on how to work with child life in your hospital and communicating with the healthcare team?
I think that it's really important for parents to remember that their first and most important role is to care for their child and to advocate. And they're going to meet a lot of people, whether it's through different departments they go to, their diagnosis process can be lengthy. Whatever that looks like, they're going to meet a lot of faces, and we don't expect them to remember our name or our role, but just that as they meet each person, to not feel that it is a bother to advocate for their child. They know their child best. And so we really rely on how they've seen their child cope in the past, what their child is sharing with them. We have family center rounds are where the family is invited to join in rounds on the morning. And so this is for those that are inpatient. So the families will step out. The patient, if they are in the place to discuss it as well, then the rounds will move into the patient's room. And the family is a part of the whole entire conversation for morning rounds. And what's nice about that is there's more transparency amongst the medical team that families can hear. What are the options for our child? What's the plan? What does going home look like? What are some goals that we need to meet this week? And so I would encourage families to participate in that. Not all children are interested in being a part of those rounds, whether they are just not interested, they'd rather watch their morning cartoon or go to the art room, whatever their other things are to do in their day. If they don't want to be a part of it, that's fine. I think that if it does happen in the room, it's really important for providers to acknowledge the child or teenager and bring them into that space. But I would really encourage families to be a part of those rounds if they feel that they have the emotional bandwidth, because it can be lengthy and it can be exhausting. I think there's a lot of value in having them brainstorming with the medical team and making them to be a part of the team and allowing the team to be able to consult on that.
Yeah, I definitely agree. I think at Duke we have a few of our physicians on the bone marrow team that will do family-centered rounds at the door and kind of at the entrance of the patient's room, and we've gotten a lot of positive feedback from parents on that process and that it makes them feel a part of the team and that they know things faster and they know what the doctors are thinking. It's coming straight from their mouths, and so I think it's been a positive thing for us as well on our unit.
And so, Molly, branching off of families, when it comes to siblings, I think as child life specialists, we're told that siblings are so easily the forgotten population here. What would you suggest for parents who have other children in the home, whether they're siblings or cousins, whatever that family makeup might look like under one roof? What would you suggest to caregivers for those other children that are impacted by hospitalization?
That's a great question. I think when it comes to siblings, they are so easily forgotten, or if they're not forgotten, they are not the priority at the time. And so as Child Life, we do try to kind of bring them back to the forefront and include them in the process as much as possible. And so at Duke, we often, during the flu season, have sibling restrictions where siblings cannot come and visit. And so that has a unique challenge on incorporating siblings. And I think that can be applicable to a lot of hospitals where you're traveling from afar and siblings aren't as present, whether you have flu restrictions or not. And so something that we do to help encourage siblings to be as much a part of the process as possible is we give the parents a piece of paper that they fill out that goes to their teacher, and it just gives them basic information about the child, being the sibling, and things to be aware of that are happening in their life, such as their brother or sister is getting a bone marrow transplant, who to call if the child gets upset, maybe some suggestions on ways to help the child cope. So, if the child is getting overwhelmed and missing their family, maybe allow them 30 minutes with the school counselor or by themselves to kind of process that before being asked to participate in classwork again. And different techniques of coping are on that piece of paper to give to their teacher. We have a similar piece of paper that we give to the parents to give maybe an alternate caregiver, whether that sibling could be staying with a grandparent or a neighbor, aunt, uncle, friend. And it just has all the things about that child that would be helpful. Bedtime routine, likes and dislikes of food, and how they take medicine and what kind of medicine and that kind of thing, allergies. And it's just a way to keep everyone engaged and interacting with each other. It helps the sibling know that they're not being forgotten, but that, their routine might be different, their life might be different for the moment, but that everyone knows how to care for them the way their mom and dad would. We also encourage a lot of FaceTiming, Skyping. We do a lot of artwork that our program then mails to the siblings, so they're receiving mail at home. Each sibling and each child is going to be unique, so we try to tailor their needs to what we can provide, but those are the staples that we do here.
And so I think one thing you touched on was school, and I know I hear a lot of stress from patients and parents about schooling. Is my child going to miss school? Are we going to fall behind? And So one thing I would say when it comes to addressing school is to reach out to anyone that's on your child's team and find out whether it's child life, social work. I know that those two teams partner here at Children to address school concerns. We have a school reentry program that's funded by a Board of Visitors grant. But to really look at what is currently in place within the hospital that we can send out, whether it's documents, people that we can send out to go and do classroom visits, to really help those students understand why it's so important that they wash their hands, why their classmate might not be in school for a couple of days or a couple of weeks. And I think that's a really big stressor. And so finding ways through your team that's already put in place to help that rather than having to reinvent the wheel, I would really encourage caregivers to reach out and ask that question to their medical team so that the medical team can get them the appropriate resources.
Yes, that's a great point.
Thank you, Ms. Fung and Ms. Spragins. More information on the role of a child life specialist in cancer care can be found at www.cancer.net. Cancer.net is supported by the Conquer Cancer Foundation, which is working to create a world free from the fear of cancer by funding breakthrough research, sharing knowledge with physicians and patients worldwide, and supporting initiatives to ensure that all people have access to high-quality cancer care. Thank you for listening to this Cancer.net podcast.